Delia and Carl, do you guys have any questions for me about the presentation? Anything that stood out?
Just comment on that. As we do surgeries and we're learning that complications happen, but the range of what you present, it helps address all that. And Ziv, you've been really helpful for me that I can come to you could come to my rescue, and I email you and phone you, and you tell me how to get out of trouble. But fortunately, I haven't got myself in too much trouble thanks to your courses.
Okay, but and that's a great point. What you call trouble is normal. Is normal because if there would be no trouble or no failure, there would be no success. It's always, there's somebody who's rich and somebody who's poor. Somebody is evil and somebody is good. There's always the contrast. So if we didn't have the bad stuff, we would not know about the good stuff. So that's also true for surgery. When you're performing surgery, for the most part, and by now you know my teachings. By now you know how I think and what are my strategy. I always focus on safety because I have in mind mostly the doctors like you, meaning everybody here in the community on the call and the doctors that take the courses, that there's not too much leeway with failure. I see that. So I believe once we focus on safety, the worst case scenario, it's not going to work out, but you're not going to compromise the patient's health. So, and I got a little bit distracted, Carl. Oh, the issue of complications is just part of surgery. You have to know how to manage complications. They will happen. They are happening. They happened in the past. It's just part of life. I had a complication today. During a surgery. My flap had a little tear for different reasons. I'm not going to get into the detail. You'll see it probably in a few videos. In a few weeks, you'll see a video about that. But complications just happen, and what we're going to try and do in our teaching is to try to anticipate these complications, try to avoid them, but if they happen, we're going to learn how to address them. Okay. Delia, any questions?
No, I would just say that, in the beginning, when you start your journey in surgeries, you are going to be so worried about so many things can go wrong, and you will be surprised, actually, that Mother Nature is generous, so you don't have to be so stressed out. You are going to do a surgery, and then you are going to think forever until the patient is coming back to do the check, the post-operatory check, and say, did I cut enough? My sutures hold it in place. Oh my goodness, how it's going to look like? The patient had pain. You're going to call about 10 times to make sure it's doing okay. So no fear. Mother Nature can be so generous with you. And I want everyone to have confidence that it's going to be successful. They have just to understand the steps, like you broke down, all the whole entire course, and then follow the principles, and it's going to work. So that's my advice, for them. So no fear. Go for it.
That's a great message. Things are going to happen. Even for specialists, it's going to happen because it's not all up to you. We're dealing with biology, and there's a saying that says, nature laughs last. Nature laughs last, and it's not always up to you. But what we need to do, and it's again a message, we're almost at the end of the webinar. My message to you is set yourself up for success. Give yourself the best conditions to be successful in anything that you do. What we're talking about surgery, get really knowledgeable. Meaning you don't have to be a university professor. You don't have to be like book smart and know all the articles by heart and read all the books. And I love reading books. But you need to know, because your patients are trusting you. Your patients are giving pretty much their lives in your hands. You are performing a surgery that could have some serious side effects, so they're trusting you. For the very least, understand what you're doing, understand what are the reasons for the particular problem, understand all the different options, and be able to choose what options will work for a particular case. I know it sounds like very complex. That's why we're trying to break it into different steps. And once you have this knowledge, you can have a better strategy of how to perform a surgery. You only then execute. And I said in the last webinar, a lot of doctors are watching a video, a lot of doctors are reading an article, and what happens, they execute. They just start cutting and they start performing procedures, and that's becoming a huge problem. Get the knowledge, get the strategies, and only then execute. So I really appreciate your feedback.